Hello everyone, we'll talk about psychological disorders this week. Firstly, let's define what is abnormal behavior. That is a behavior that is deviant, maladaptive, personally distressful over a relatively long period of time. Deviant means statistically unusual, okay? That we don't call it as normally occurred. Maladaptive means interfering with a person's ability to function effectively in the world. And personally stressful means something troubling a person in a long period of time. Okay, there are some theoretical approaches to psychological disorders. First one is biological approach. It attributes psychological disorders to organic internal causes. It focuses on the brain, genetic factors as sources of abnormality. While we are talking about psychological approach, it emphasizes the contributions of experiences, thoughts, and emotions, and also personality characteristics in explain disorders. And you have sociocultural approach. It emphasizes the social context, such as individuals' gender, ethnicity, socioeconomic status, family relationship, and culture. And lastly, we have biopsychosocial model, and according to this model, abnormal behavior can be influenced by biological, psychological, and sociocultural factors. Actually, it combines all of the three remaining approaches. And to mention about major categories of psychological disorders, firstly we can talk about anxiety disorders. Actually, psychological disorders are involving, some of them are involving fears that are uncontrollable and disproportionate to the actual danger the person might be in and disruptive of ordinary life. So under anxiety disorders, we have either generalized anxiety disorder or panic disorder. For generalized anxiety disorder, also we have phobias. For generalized anxiety disorders, we refer to anxiety which stays for at least 6 months and which the individual is unable to specify the reasons for it. For panic disorder, anxiety in which the individual experiences recurrently sudden onset of intense terror, often with or warning or non-specific cause. And thirdly, we will talk about phobic disorder under anxiety disorders. It is the anxiety disorder characterized by an irrational, overwhelming, or persistent fear of a particular object or situation. You can see the types of phobia here in the table, and actually it's going on here through these slides. And fourthly, we have obsessive compulsive disorder. Anxiety, it is defined as an anxiety disorder with the individual who has some anxiety-provoking thoughts that will not go away, and or urges to perform repetitive ritualistic behaviors to prevent or produce some future situation, like cleaning the hand lots of time, or locking the door of your house 5 times and feeling very anxious and irritated if you don't do it. Actually, when we are talking about obsessive compulsive disorders, obsession means the thoughts accompanying your behaviors, okay? Your repetitive thoughts. If I don't close this door, lock this door 5 times, then I will die, okay? Associated thoughts. But for compulsions, we are referring to the behavior, repetitive behavior, that is locking the door 5 times. And we have post-traumatic stress disorder, again under the heading of anxiety disorders, and it develops through exposure to a traumatic event that has overwhelmed the person's abilities to cope. For example, think that you have been exposed to an earthquake, and this was a traumatic experience for you. And afterwards, if your anxiety symptoms go on after the earthquake has finished for a longer period of time, we say that you are suffering from post-traumatic stress disorder, okay, PTSD. And secondly, when we are talking about psychological disorders, we are referring to mood disorders. And this is psychological disorder in which there is a primary disturbance of mood which colors the entire emotional state of a person. Firstly, we will talk about depressive disorder under mood disorders. Most of you are familiar with this, I guess, but depressive disorder is a mood disorder in which the individual suffers from depression, clinical depression, that is not having any pleasure from life. Major types of depression are major depressive disorder, major depression diyoruz, or dysthymic disorder. This dysthymic disorder is not a very common one. And secondly, bipolar disorder is again a mood disorder characterized by extreme mood swings that include one or more episodes of mania, an overexcited, unrealistically optimistic state. These bipolar people, you see them sometimes in depression. They are deep down and they don't have any pleasure from life. But after 2 weeks, let's say, or 1 month, you see that they are feeling very happy. They are like manic and they have lots of energy. They are moving around, etc. And afterwards, after let's say 1 month, it of course changes from client to client. You see them like again depressed. Okay, so there are some phases, some episodes of mania and depression in bipolar disorder. Thirdly, we will talk about dissociative disorders under the heading of psychological disorders. And dissociative disorders involve a sudden loss of memory or change in identity due to dissociation, separation of the individual's conscious awareness from previous memories and thoughts. We call it in Turkish disasosiyasyon. You are tearing up into pieces. It is like that, okay? The client loses memory, sometimes maybe comes to the point of keeping away from reality. So at that point, the person tears up into pieces. Firstly, there is this dissociative amnesia under dissociative disorders. It is characterized by extreme memory loss that is caused by extensive psychological distress. You forget. And the other one is dissociative fugue, and the individual doesn't develop any amnesia, but unexpectedly travels away from home and sometimes assumes a new identity. Just you are tearing up. And also dissociative identity disorder, DID we have. This was formerly called multiple personality disorder. There was a series of film. It started with Bruce Willis. Lost, I guess? No. I don't remember the name of the film. If you remember, please write under the comments. There were 3 episodes of that film coming after the previous one. Okay, on multiple personality disorder, and in this disorder the individual has 2 or more distinct personalities or identities. Each has their own memories, behaviors and relationships, and each identity has its own relationships as well in multiple personality disorders. And fourthly, we'll consider schizophrenia. This is considered as a chronic and severe brain disorder. It's a disease that makes it difficult for a person to tell the difference between real and unreal experiences. The reality is not the same so-called normal people perceive it, okay? and they have some difficulties to think logically, to have appropriate emotional responses to others, and they have difficulty in some aspects of memory, and they have difficulties in acting appropriately in social situations. And lastly, we can consider the personality disorders and chronic maladaptive cognitive behavioral patterns that are thoroughly integrated into an individual's personality are so-called personality disorders. Antisocial personality disorder and borderline personality disorders are one of these. And when we are talking about antisocial personality disorders, we are considering that they are characterized by guiltlessness, law-breaking, exploitation of others, irresponsibility, and deceit. And for borderline personality disorder, it's a psychological disorder characterized by a pervasive pattern of instability in interpersonal relationships, like self-image and emotions, and of marked impulsivity beginning by early adulthood and present in a variety of contexts. They are, as stated, not stable, and at the very extreme of borderline personality disorders, they may also sometimes lose their perception of reality in severe cases. And to briefly mention about the therapies, actually we have biological therapies, also they are called biomedical therapies, treatments that reduce or eliminate the symptoms of psychological disorders by altering aspects of the body functioning. And this is usually used in treating anxiety disorder, depressive disorder, and psychotic disorder, and accompanied by medication. Also, ECT, electroconvulsive therapy, is used as for it is shock therapy, which uses drugs in treating disorders. And we also have psychosurgery. It involves removal or destruction of the brain tissue to improve the individual's adjustment. And lastly, I'll talk about psychotherapies. You already know that psychotherapies are non-medical processes that help individuals with psychological disorders recognize and overcome their problems. When you graduate, if you take any psychotherapy approach training at such, in addition to your undergraduate and graduate education, you can be a psychotherapist. And the approaches for psychotherapies are psychoanalysis, client-centered behavior, cognitive, and group therapies. You will learn these in theory courses, I guess. So these therapy techniques are utilized in order to manage psychological disorders. But of course, for schizophrenia, you need to use medication. Just psychotherapy is never enough. And for anxiety disorders or major depression or borderline disorders, usually medications are accompanied as well. This is the end of my presentation. If you have any questions, write them under the comment bar, or maybe you want to mention something. It's free, of course. See you.